good afternoon, bon après-midi à toutes et à tous. Au cours des 2 derniers mois, le Nouveau-Brunswick a été durement touché par la 4e vague de la pandémie de COVID-19. À cause du variant Delta du virus plus contagieux, nous avons enregistré un nombre de nouveaux cas de maladies graves et d'hospitalisations jamais vus dans les premières phases de cette pandémie mondiale. For the last 2 months, New Brunswick has been hit hard by the 4th wave of the COVID-19 pandemic. Driven by the more contagious Delta variant of the virus, we have experienced levels of new cases, serious illness, and hospitalizations not seen during the earlier phases. Through the efforts of all New Brunswickers, we are making progress in slowing the pace of this 4th wave. The circuit breaker measures put in place in zones 2, 3, 4, and 5 were effective in reducing the spread of infections in those communities. However, in Zone 1, which has been in a circuit breaker for 6 weeks, we have not seen the same results. So the cases remain high, which continues to threaten our hospital system. Over the past week, 49% of new COVID-19 cases reported in New Brunswick were the result of transmission within private households. The average age of a new case during the past week is 33 years of age, much younger than we were seeing earlier in the pandemic. I must stress that it is the unvaccinated who are most likely to experience the most serious effects of COVID-19. The course of the pandemic is changing and we must change with it, adjusting our measures to precisely target the causes of COVID-19 spread. Il est clair qu'une différente approche est nécessaire et le Premier ministre Higgs en parlera dans quelques minutes. The latest 4th wave has led to an increase in new cases in the last several days. Yesterday, New Brunswick reported 82 new cases of COVID-19, the highest number in a month. Today's number of new cases is 72, above our rolling 7-day average of 60 new cases per day. We have also seen a slight increase in the number of people admitted to hospital and to ICU wards, most of whom are unvaccinated. 28 personnes sont maintenant hospitalisées dans la province, dont 14 aux soins intensifs. We now have 28 New Brunswickers in hospital, including 14 in intensive care. But we also have reason to be hopeful. The number of daily recoveries remains strong, and we are seeing very few new cases in northern and northwestern New Brunswick, which had been under circuit breaker restrictions just a few weeks ago. Aujourd'hui, Santé publique signale 71 rétablissements de la COVID-19. C'est une statistique importante parce qu'elle montre que la majorité des personnes qui contractent le virus se rétablissent rapidement sans connaître les pires effets de la maladie. Today, Public Health has reported 71 recoveries from COVID-19, and this is an important statistic because it demonstrates that the majority of people who contract the virus are recovering quickly without experiencing the worst effects of the disease. We are now at 566 active cases across the province. It is vital that everyone keeps their close contacts as small as possible. It is also very important that those who are directed to self-isolate do so properly. As we continue to learn about COVID-19, it is clear that the close contact between infected and non-infected people contributes to the spread of the virus. Recent medical studies have shown that the virus can be spread through the air in tiny droplets of moisture, especially in close contact situations. You can protect yourself by avoiding the 3 C's: closed areas, crowded venues, and close contact. So please be aware of your surroundings. And you've heard me say this many times before, but it's because we know that doing the following does work. Wearing a mask when in public places, maintaining 2 meters of physical distance from others, avoiding crowded indoor spaces, and keeping your close contacts to the lowest number possible. Wash your hands regularly and thoroughly, and stay home when you don't feel well. Watch for symptoms of COVID-19 and seek testing when symptoms emerge. This is very important. I know that for a long period of time, people were really not as concerned about COVID prior to our last surge, but with this most recent surge and moving forward, it really is important to continue with our testing. So please continue to get tested when you have COVID-19 symptoms. So this is good advice no matter where you live in New Brunswick. It is all part of living with COVID. And I am so pleased that 87% of eligible New Brunswickers have made the choice to get fully vaccinated against COVID-19. And also, more than 93% of eligible New Brunswickers have received their first dose. In combination with the other public health measures I have mentioned, vaccination provides strong protection against the worst effects of the virus. Combinée aux autres mesures de santé publique, la vaccination offre une protection solide contre les pires effets du virus. Il y a un segment de la société qui n'a pas été vacciné, les enfants âgés de moins de 12 ans. Mais cela changera bientôt car Santé Canada a indiqué que l'approbation du vaccin de Pfizer pour les enfants âgés de 5 à 11 ans sera donnée au cours des prochains jours. Nous serons prêts lorsque la vaccination de tous les jeunes enfants du Nouveau-Brunswick sera approuvée. This is one segment of our society which has not been vaccinated, children under the age of 12. But that will soon change as Health Canada has indicated that approval to use the Pfizer vaccine for children aged 5 to 11 will happen in the coming days. We will be ready when approval is given to vaccinate all of New Brunswick's young children. A plan is in place to begin vaccinations for children in all regions of the province. And as a parent, I know that everyone wants to protect their children and keep them healthy. I urge every New Brunswick family to make sure that their children are vaccinated because this will help us slow the spread of COVID-19 and protect those most vulnerable in our society. We have all been challenged by the ongoing COVID-19 pandemic. In addition to struggling against the virus, we are also fighting COVID fatigue. And I ask each of you to stay strong, stay vigilant, look after each other, look after yourselves. We can get through this by continuing to work together. Thank you.
Good afternoon. Bonjour. Over the last few months, we've taken the necessary steps to reduce the spread of the Delta variant. C'est particulièrement vrai pour les personnes qui demeurent dans les régions où une mesure couvre-feu est en place. Overall, the number of active cases and the hospitalizations have been relatively stable in most regions of the province, which is reassuring. In many areas of the province, the circuit breaker restrictions we put in place worked. However, in Zone 1, the Moncton region, after 6 weeks, those measures are not having the desired impact. You know, I get it. People are tired of COVID, and we're 87% fully vaccinated, and it's like, well, why are we not able to get a handle on this in this region? And how do we avoid the constant, I guess, gatherings that are over and above what is allowed for public health protection? So we want to strike that balance. We want to make sure that people that are vaccinated can have life as normal as possible. And we want to encourage each of you to get your third dose so that we stay fully vaccinated and protected. But we also want to allow you to get back to doing things that you've always wanted to do. So while we have to keep some restrictions in place, we are focusing on those areas that are causing the greatest concern with our outbreaks and our continued case counts. So as a result, we will change our approach. Rather than penalize everyone, we are focusing on key areas of concern, and that is why we are implementing a targeted measure, province-wide, to address where we are seeing the virus spread. We are continuing to see increasing case counts as a direct result of household transmissions. To address this, beginning tomorrow, November 19th at 6 p.m., when someone in a household tests positive for COVID-19, everyone in that household must also self-isolate, regardless of vaccination status. This measure will be in place throughout New Brunswick. Household members who are fully vaccinated, however, and test negative with a PCR test on day 5 will be able to leave isolation. And this is because we recognize that even though you've been vaccinated, you can still be a carrier. you can still transmit to someone else. So if someone in your household tests positive and you're connected with that person and you've had exposure, you need to ensure that you too don't become someone who's transmitting it to someone else. And that's why we put in this change. A negative PCR test on day 10 will also be required. This is similar to the approach that we've seen in other provinces. Also beginning tomorrow, November 19th at 6 p.m., we will lift the circuit breaker restrictions in Zone 1, the Moncton region, and Zone 7, the Miramichi region. We have to gain control of the spread in all areas, but to focus on the areas that are a problem. And as I said earlier, to strike that balance where people will follow the rules, you will get vaccinated, you will wear your masks, and you will be cognizant of areas that you could be exposed. We must do this so we do not overwhelm our healthcare system. And we believe that if we focus on the areas of a problem, which Dr. Russell mentions 50% of our cases are in household gatherings, that we can get control and stay in control. What is being asked of you today is necessary and is important if we want to keep New Brunswickers safe. Je remercie toutes les personnes qui continuent de respecter les mesures en place et qui prennent les mesures nécessaires pour se protéger et pour protéger leurs proches et leur communauté. As we've been saying for some time now, we have to find the balance between what we think of as back to normal and living with the COVID-19 virus. And I cannot stress enough that getting vaccinated as well as following the measures in place is crucial to your health and our success as a province. When your next vaccine, your third dose, is available to you, please book your appointment and get it. We know that while being vaccinated does not guarantee you won't become sick with COVID-19, it does greatly reduce the likelihood of you becoming seriously ill and needing hospitalization. Nous devrons à tout prix nous assurer que notre système de soins de santé reste stable et que l'augmentation du nombre de cas n'a pas d'incidence sur les autres secteurs de soins de santé. Tomorrow is a deadline for the government of New Brunswick workers to show they have been vaccinated. We want to be sure that government employees have a healthy and safe workplace, which is why we have made it a requirement that all staff be vaccinated against COVID-19. At the end of the day tomorrow, any employee who is not fully vaccinated or who has not received one dose and has a confirmed appointment for a second dose will be sent home without pay. This applies to all areas of the public service, government department, school districts, the healthcare system, and Crown corporations. There will be very, very few exceptions to this. Nous savons que la grande majorité des employés du gouvernement provincial sont pleinement vaccinés ou ont reçu au moins une dose. The numbers of unvaccinated employees are relatively low. In government departments, 2.9% of employees are currently unvaccinated, about 307 people. In school districts, that number is 4.1%, or about 792 employees. In the regional health authorities and Medivie, 3.4% of employees are unvaccinated, or 734 employees. And in the Crown corporations, 2.5%, or 162 employees are unvaccinated. I am pleased to say we have seen enormous improvements in employee vaccination numbers since this requirement was first announced. Initially, nearly 10% of employees throughout the government were not vaccinated, and now we are down to just over 3%. We are still hopeful that these remaining employees will choose to get their vaccinations. But in the meantime, we must protect all of those working here at the Government of New Brunswick. I urge anyone who is not yet vaccinated to please do so by booking an appointment with your nearest vaccination clinic or participating pharmacy. Je sais que les 20 dernières mois ont été difficiles pour de nombreuses personnes pour toutes sortes de raisons. But we are making progress. Nous réalisons des progrès. Et avec votre aide, nous allons continuer à progresser. I encourage everyone to remain patient, follow the measures in place, and remember, we will get through this together. We have seen the system stabilize. We know that if we just don't lose hope and we try to balance our approach of getting back to normal with our lives while at the same time living with COVID, we will manage. We will see families once again. We will have the experiences that we've always enjoyed with families, friends, kids, grandkids, and sports. We will be in a position that we will manage with COVID. I'm excited about that day, and we're all looking forward to it because we are indeed COVID fatigued. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci beaucoup à vous deux. Nous allons maintenant procéder aux périodes des questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. We'll now proceed to question period with members of the media. Each reporter will have one question and a follow-up. You have the right to pose your question in the official language of your choice. Callum Smith, Global News.
Thanks, Bruce. Can you hear me okay?
Yes.
Perfect. I'm just wondering if we can get a bit more detail on this household isolation. Just, I guess, what that looks like, and we heard the status for fully vaccinated individuals, what their requirements are. How do you justify that, I guess, to people who have done exactly as asked and been fully vaccinated?
Yeah. So I'll start, and if the Premier wants to add, certainly the issue around what is the thing that's going to reduce the risks the most is addressing the issue of household transmission. So approximately 49% of cases in the last 7 days are the result of transmission within private residences in their own household. And transmission within the past week was primarily among unvaccinated individuals. So with respect to how these measures help in terms of targeting that, it means that if those people who are cases and close contacts are isolated to a larger degree than they have been, then that means that the circuit breaker measures in terms of imposing those restrictions on an entire zone, we're now being able to target, with the help of JPS in terms of enforcement, the real place where we're seeing that transmission the most.
And I guess if I was just to add to that, it would be that in trying to get back to, and removing the circuit breaker per se, it's the focus on the particular households. And if every household who is vaccinated would ensure that anyone who visits them within their bubble is also vaccinated, this becomes less of a problem. But what's happening is we're seeing that there are members that are unvaccinated who can then have the vaccinated person become a carrier, or the vaccinated person could become a carrier and bring it into a household. So this is the next move to finding a new norm, but it's recognizing the challenge we're facing right in the household, because it's hard to question a family member and say, are you vaccinated or not? But really, that's what it comes down to. A family member or friend that's in your group that you're basically saying, have those conversations, because we need them as well to be part of the solution.
Thank you. Mr. Smith, do you have a follow-up today?
Yeah, I guess I'm just wondering how you'll support people who have to be put off work even despite full vaccination. And I guess what's your message to those who will presumably be frustrated and obviously impacted by this move?
Get vaccinated.
Frederick.
But how will you support people who are put off work as a result of this policy?
There is in relation to those that are isolating, yes. Was that the question, or was the question about those being put off work because they're not getting vaccinated?
Sorry, for those who have to isolate due
Yes.
to a case within household.
Okay, you're right. So it is in the press release, and on our website it does talk about that, how we protect those that are forced to isolate. So that is identified in the press release and where to get the information.
Merci. Thank you, Mr. Smith. On va passer avec M. Frédéric Camarano avec Radio-Canada.
Vous pouvez m'entendre? Bonjour.
Vas-y.
Ça marche? Parfait. Monsieur le Premier ministre, vous avez eu besoin d'avoir recours à l'état d'urgence pour assurer le bon fonctionnement du système de santé pendant la grève. Là, il y a quelques centaines d'employés, si je comprends bien, en santé qu'on pourrait mettre en congé non payé. Comment allez-vous assurer que le système de santé va bien fonctionner?
Well, certainly over the last several weeks, as we've led up to this November 19th date, individuals in all sectors, Part 1, 2, and 3, and 4, so including health, have worked diligently, not only to get the vaccination levels up, which we've seen have gone from 10% vaccinated to down to only 3% that are not vaccinated, but to mitigate the risks and be able to offset the fact that these individuals would not be allowed to come to work. So obviously, we will ensure that the public health is protected, and we will ensure that the hospitals can function and deliver services as they have been. But we are working very closely with the health authorities, and we're working to mitigate the situations. But obviously, if this is what it takes in order to get people to be vaccinated, so at the end of the day, the patients coming and going at these facilities who are expecting, us to be fully vaccinated, that's our goal. And if this is what it takes in order for people to go the next step and be vaccinated, then I guess that's where we are, and we have to reflect that is the bigger goal right now.
Votre deuxième question, M. Camarano.
Oui, j'aimerais savoir comment est-ce qu'on va faire respecter cette nouvelle règle sur les ménages qui doivent s'isoler en entier lorsqu'un de leurs membres a reçu un test positif.
We can't hear it.
Moi, j'ai pas compris la question. Je
Peux-tu
peux pas entendre.
répéter plus fort, M. Camarano?
Oui, pas de problème. Sur la question des ménages, que tout le ménage doit s'isoler lorsqu'un membre a reçu un test positif, comment allez-vous faire respecter cette règle?
Still can't hear.
Did it? So is that, in this case, how do we know, if I understood the question correctly, it's how do we know if someone has been vaccinated or if they're tested positive that they're actually following that protocol? And I guess, a lot of this whole process has been on the honor system. But knowing that this is the reason we're having these problems in the communities, that it is household gatherings, and knowing that our hospitalizations are 50% plus related to connections back to a household gathering, and these are the problem areas, I guess we are relying on individuals who are vaccinated to put some pressure on those that may be within their bubble that aren't, and that they will be tested or they will require testing. And then it's like the isolation procedure we had all along. It is based on our system. However, when we have record of positive testing in a household and an isolation requirement, our public safety folks will be following up as we have done throughout the pandemic.
Merci. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Premier Higgs, some provinces have backtracked on their decision to put unvaccinated workers on unpaid leave. If I'm doing the math right, I think it's about 2,000 people that could potentially be on unpaid leave in New Brunswick as of tomorrow. Are you anticipating any major voids left by those workers, or do you feel confident we can move along without them? And why is it so important to you to stick to this decision?
Well, I guess for me, when you put a plan together and you believe in the plan, then it's important to find a way to follow through with what you've provided lots of information and requirement and reasons to do so. Working with the administrators in all sectors, they're all committed to ensuring that the employees that are at work are safe and that their workplace is safe. And so they've looked at how they can manage it. And they've also worked very hard to get their employees vaccinated. When I mentioned the going from a 10% unvaccinated to 3%. So we're talking only 3% on average of the workforce in the different parts of the government that are not vaccinated. So, you know, some may put a date out there and say, well, we'll do our best efforts. But when we put a date out there, we really try hard to meet it. And that doesn't mean that's always possible, but we believe that it is very important that we control this variant, and we do so through vaccinations that have been proven to be reliable, effective, and are the best means we have in order to get back to normal. So we've done a lot of work to mitigate the impact of these employees that, well, I'd like to think they'd get vaccinated tomorrow, but at this point, we can't plan on that. So we have to plan on them not being able to work on the next day on the 20th.
My follow-up is also for the Premier. A significant number of just Canadians in general have put off going to the hospital for health issues over the course of the pandemic, either just out of fear of getting COVID or burdening the system, so that something that might have been minor in scope could potentially be more serious down the line, and then obviously more costly to taxpayers as well. Are you anticipating a post-pandemic surge in costs due to the need to treat more serious healthcare cases that didn't have to be so serious if they were dealt with now?
Well, I guess certainly that was part of us getting back to work a few weeks ago and bringing the legislation forward because, or the regulation change, because we had to ensure that these procedures were allowed to continue and that our hospitals could continue to run, and we couldn't get ourselves in a position that it would be so difficult to get back. But it wasn't a cost factor. It was a factor of the health and safety of the citizens that we couldn't prolong some of the more urgent requirements. So that would be no different here now. I mean, we want our hospitals to run effectively, but we want people to be able to come to our hospitals and feel safe in doing so. Someone should not have to come to a public hospital in New Brunswick and feel a health threat to come there. And so, you know, if you think particularly about health workers and people coming to a hospital and you think health workers who are not getting vaccinated, you know, there's almost a hard issue to explain or understand there. But if people are going to feel safe, and I mean our citizens are going to feel safe to come to a hospital, then they should feel that they are being protected and the people that are serving in there are fully vaccinated, and their risk of not only of let's say of getting COVID, but is very minor, and they can focus on the reason they're there to begin with, which is their particular health issue.
Thank you. Justin Dupuis, l'Acadie Nouvelle.
Oui, merci Bruce. Je voudrais savoir, avec les employés des différents secteurs qui pourraient être suspendus parce qu'ils ne sont pas vaccinés, est-ce que vous anticipez des problèmes de service dans certains secteurs en particulier?
Well, certainly that's been the effort that every different department has gone through over the last month and a half, 2 months, is understanding who would potentially not be vaccinated, and now, of course, we're down to the short list, and how do we mitigate them not being at work. So so every area has looked at that and are managing through that, and that's, you know, I made the comment that there would be very, very few exceptions, and each department will assess that. But right now, that is certainly, we're in a position right now to say, you know, we're going to be able to move forward with our deadline as originally intended, and it's important that we do so. And we would just like to see that 3% decide to get vaccinated.
Bien, merci. Puis, en fait, je me demande, donc vous parlez qu'il y a comme des plans de contingence pour un peu mitiger ces effets-là, mais je pense, par exemple, dans le secteur de l'éducation, est-ce qu'on sait si des enseignants qui n'ont pas voulu se faire vacciner, est-ce que ça pourrait causer des problèmes dans les salles de classe? Parce qu'on a entendu parler beaucoup d'histoires de districts scolaires qui ont de la difficulté de trouver des suppléants, par exemple.
We have, in terms of the issue within the education system, we believe that we can manage this, and it'll be of minimal impact to to the actual instruction, but that doesn't mean there won't be some schools, some areas, that won't be the case. You know, we're running currently in part 2. I think that around 700, 800 employees across the entire network. But every district has looked at the impact on their particular district and how they mitigate that. And certainly we're being told by the department that they can manage this. And again, I just optimistically say I'm hoping that the fact that it's important to us, we need to hold the line on this, and that it'll encourage people to get vaccinated.
Merci.
Merci. Bobby Jean McKinnon, CBC. Ms. McKinnon,
I'm sorry, can you hear me now?
a little louder, please.
Yes, thank you. Premier Higgs, as Dr. Russell mentioned, Health Canada is expected to approve the Pfizer vaccine for children aged 5 to 11 tomorrow. Once a vaccine is approved, does the province intend to make COVID vaccination mandatory in schools? Why or why not?
Well, at this point in time, and Dr. Russell may want to speak to this as well, but in this point in time, you know, our goal would be to really put the push on for everyone to get vaccinated. And, you know, whether this stage it becomes absolutely mandatory, I mean, I think that's where we'll need to be ultimately, but that's not the position that's formalized at this stage. So we would be hoping that parents would decide to be vaccinated, and we'll weigh that against the total aspect of vaccinations within the province and the issues that we have in the schools with transmission. But ideally, it's good to know this will come soon here for us to have these vaccines available, and that will help limit transmission the more that are vaccinated. So we'll be certainly pushing for that to happen.
Ms. McKinnon, a follow-up?
Yes, for Dr. Russell, please. Green Party leader David Kuhn has raised concerns about some recent changes he says makes your position more subject to political influence. Has your position, job description, responsibilities, and or level of authority changed in any way in recent months? And how do you respond to these concerns about your independence?
Well, the only changes that have happened, Bobby Jean, really were over a year ago. We did add an extra position to the Department of Health, and that was the extra position of an Assistant Deputy Minister for Public Health. And that change was really as a result of the very complex nature of all the public health things that we were trying to manage, and to give me more support in terms of operationalizing any strategies and policies and direction.
Thank you, Ms. McKinnon.
I'm sorry, but just in terms of your position.
I have always reported to the Deputy Minister, and I continue to report to the Deputy Minister, and my predecessors have reported to the Deputy Minister.
Harry Forstall, CBC.
Are you able to hear?
Yes, thank you.
Hi, can you hear me?
Yes, thank you.
Wonderful, thank you, Bruce. Premier, the rules as we understood them were that New Brunswick workers would have to show tomorrow they've been vaccinated. Today you say they need to show proof of 1 dose and evidence of a booked appointment for a 2nd dose. Why was this changed, and what difference would it make in the numbers of people affected?
Well, certainly, Harry, there's been some recognition that if someone, you know, has the, I guess, the ability or shown the ability to get their first vaccine, then we would believe that they would indeed, when the time is right, to get their 2nd vaccine. So we're willing to consider that as a good faith approach to being vaccinated. But if you, at this point as of the 19th, tomorrow have not gotten any vaccine, despite the repeated pleased from us to have done so and from their departments, then there's the real reality recognition that, okay, I guess you're not going to get vaccinated, so we'll move on without you.
And part of my question there was, what difference does it make in the numbers of people affected?
Well, right now, because the ones we're dealing with right now are those that have not got any vaccine. So there's about 2,000 that do not have a vaccination. I don't know the numbers that are partially vaccinated. Right now, one dose, about 860. So we have 860 that have received their one dose, and they are not yet able to receive their second dose, but they will be allowed to continue in the workplace.
Mr.
Right,
Forstall,
thank
do
you
you
for
have a
that.
quick
My second
follow-up? Yep.
I do, Bruce. Thank you. Yes. Nearly half the province's First Nations recently confirmed outbreaks of COVID-19, all within a 4-day period. And I'd like to ask Dr. Russell what the epidemiological explanation might be for those communities all reporting outbreaks in the same 4-day period. What is the rate of vaccination in Indigenous communities?
Well, Harry, we've had some really great conversations with our counterparts in all First Nations community around the province, ongoing meetings and surveillance discussions around vaccination and outbreak management, et cetera, throughout the entire pandemic. With respect to moving forward, we have made a commitment that we will change the way we report on First Nations communities with respect to outbreaks and case numbers, and we are having those discussions right now. With respect to vaccination levels of all First Nations communities, I can tell you that the overall rate is quite high. Does it differ from community to community? Yes, but the overall rate is quite high, and as you know, they were the first in our rollout plan in terms of populations that we targeted to make sure that they had their first and second doses very early on across the country. That was a federal commitment. So we upheld that commitment, and again, we continue to work really closely with all First Nations communities. We've had extremely productive conversations at all levels throughout the pandemic, and at the regional level, I know the staff have been working really closely and really hard to make sure that as things evolve in terms of whatever situations, in terms of case management, outbreak management, et cetera, they do have that input from the communities at this time.
Thank you.
I just want to understand the epidemiological reason for an outbreak at half of the province's First Nations. Do you know why?
Well, I think what I can say about all cases in the province, you know, wherever there are high case numbers, and I do have the breakdown zone-wise from zone to zone, we see transmission in households. So wherever you live in New Brunswick, whatever zone you're in, if you have a high level of cases in a particular zone, we are seeing that in all zones, the transmission is really within households. So, and when we look at how the population is impacted across the province, we are seeing that those people who are unvaccinated have higher risks of severe outcomes, and those are the people that we see mostly requiring hospitalization and ICU admission.
Ailish Bonang, CTV.
Hi, folks. Can you hear me?
Yes, thank you.
Okay. My question is for Dr. Russell. You earlier in the conference here, you mentioned the 3 C's as a key way to stay safe, and with avoiding crowds and closed spaces, making that list. So with that in mind, why are events like the current hockey tournament taking place in Moncton this weekend and right now that expect to bring hundreds of people into the city that you also said is one of the worst spots for transmission right now? Why are events like that allowed to take place, and how concerned are you that there will be cases from this event where families will likely bring it home and then add to that household transmission?
So throughout this last surge, we've really, again, tried to focus on what are the risks, what are the areas that are most at risk. People who are not vaccinated are most at risk. Transmission in households, that is a risk area as well. People traveling to events that require proof of vaccination is lower risk. It's not zero. And again, this is part of managing COVID moving forward by managing the risks as best we can and balancing that with the ability to participate in certain events and situations, having the economy open, having schools open. Again, we're trying to manage COVID with a targeted approach, and that's how that fits in with our current situation.
Ms. Bonang, do you have a follow-up?
I do. I'm being told that there's currently an outbreak of COVID at the Dorchester Penitentiary, with quite a few inmates as well as staff testing positive recently. Wondering if you can confirm that, and if so, what's being done to help mitigate that situation?
I only have a few details on that situation because it is currently under investigation. So I know my medical officer of health in that region is having meetings this afternoon to discuss that situation and get more information. I would have more information after those meetings take place and the investigation is further along.
Thank you. Savannah Odd with the Telegraph Journal.
Hi there. I'm just wondering, Dr. Russell, if you can explain how these new isolation rules are different, I guess, from what close contacts would have already been told by public health. So were close contacts not already required to isolate?
If they were vaccinated, that's the difference. So as of right now, moving forward, close contacts of cases who live in the same household, whether they're vaccinated or unvaccinated, will have to self-isolate. Vaccinated close contacts, high-risk close contacts, will have to get a day 5 and a day 10 test.
Follow-up, Ms. Odd?
Yeah. So just to confirm, this applies only to close contacts in the same household, or
Correct.
all close contacts?
Well,
and
high-risk close contacts. So those are technically the ones that live in the same household or have spent time in the household, like they're staying overnight, et cetera.
Okay, so I guess why not all close contacts to the case in general? Why just their household?
Because there is a difference between a close contact that is considered higher risk in the same household, because that's where we're seeing the transmission. So again, we're identifying the risks that really need to be addressed and mitigated, and that's why we're applying these new measures to do just that.
Thank you. Isabelle Legier with CBC.
Hear me okay?
Little louder, but yes.
Hi, can you hear me okay?
Yes.
Okay, perfect. Premier Higgs, will employees still have access to their benefits while on unpaid leave? And does the vaccine mandate also apply to employees on sick leave?
It would apply to, no, once they're put off on leave, they wouldn't have access to benefits, as I would understand it. If they are off on sick leave, and I guess I would preface that to say that it wasn't a sudden situation of sick leave. Let's say it started tomorrow on the 19th, kind of coincidentally. That would be challenged as a question. But if someone is off on sick leave now, obviously for valid reasons, and then their benefits would continue.
Do you have a follow-up, Ms. Legier?
I do, yep. Do you have any indication of how many of the employees being placed on unpaid leave intend to get their shots? And how long will you allow positions to sit vacant before you look to start replacing people?
Well, we don't have any real knowledge of let's say the 2,000 people that are in question here, of them intending to get their shots. In fact, it would be just the opposite. They're on the list because they don't intend to get their shot. And at this stage, you know, we look at that in terms of the duration. But, you know, we're talking weeks here, not certainly months. And the idea is that if you've decided and you go on unpaid leave not to be vaccinated, then that would need to be corrected within a very short period of time. And then we'd have to determine when you'd be able to come back to work, because in that situation, it may mean you have to receive both doses, which would require, you know, the duration of several weeks. So in fact, if you're not able to work, if you're not vaccinated tomorrow and you're put off on unpaid leave, you could be out for many, many weeks in order to go through the vaccination process, and maybe not be able to come back at all. So again, the best way of continuing your employment with the government is to get vaccinated.
Thank you.
Thank you.
Merci aux membres de la média. Voilà la fin de notre mise à jour. Merci beaucoup. This concludes today's update. Thank you for joining us.